everybody. Happy Friday. Here in the apocalypse, it's Friday, September 18th, 2020. Thank you so much for being here. Have a look at this beautiful view at Falls of Rough. 70 degrees out, we got some wind, and I hear some motors out there. So I keep hoping we're going to see a boat. But it doesn't look like we're going to be so lucky today. Oh, well. That's okay. How are you all doing? I know how I'm doing. I'm barely hanging in there, I think, a lot of the time. And I have a problem that I need you all to help me solve. The Bowling Green Daily News, actually, no, this might be the Lexington Herald Leader, has sent me a questionnaire, a candidate questionnaire, and they've got an interesting question that could be answered very simply, or there could be detail applied. And we'll get to the question here in a second. First of all, glad you're here. I'm Hank Linderman. Welcome to Getting Angry, which of course means we don't want to act like damn fools. We want to use our anger to focus our determination to do what we need to do, coming up really, really soon. Well, anyway, I see Mark Andes is here. Mark, I'm hoping you're willing to perform when we do our online fundraising that's coming up next Saturday, not tomorrow, next Saturday. I'm hoping you'll help me. And I hope you're going to share. Cindy is here. She's sharing. Bill McNichol is asking us to share. Jim Porter's here. We have a special guest today. Let me show you his picture real quick. John Winkelman, who we haven't actually met in the flesh. Someday we will. We met over a Zoom chat, and it turns out John is an expert on, has been studying single payer since he was back in school back a few years ago. So I think he did one of his papers on this. So we'll be talking about that. But let me first run this problem past you, as I've got a question I need to answer. And the question is, what grade would I, as a candidate, give President Donald Trump for his presidency? What grade? Now, the simple answer would be to give a single grade. But I'm inclined to break it down into categories. So, for example, handling of the pandemic, handling of the stock market. So why don't you all give me some categories and some suggested grades? There's some things he's probably done well at. I think if you're, if you're focused on the stock market continued the rise that it had begun under President Obama. In fact, when you look at the curve or the slope of the economy, it moves up in a really predictable angle all through all 8 years with some wiggles. But if you back up far enough, it's practically a straight line through President Obama's 8 years in office, and that continues through President Trump. Mary Richardson's here. Hi, Mary. You know what we need you to do. You know what to do. So the economy, turns out the economy liked having, it's a fire, liked having gasoline thrown on it, all that, those tax breaks and all that stuff that helped out. But I'm not convinced that there's much else that we can say. Jim Porter says the environment, F.
Now wait just a damn minute.
I'm going to give that to you. Jim, I think the environment would definitely be an F. How about taxpayer money wasted on golf? A. Cindy, I think A. That's good. Taxpayer money wasted on golf. A+. I think that's a winner. I'm liking this. COVID-19 F. So anyway, put all those in there. Help me out, because I have to answer the Lexington Herald Leader, and I think the more clever it is, the better. So I'm loving taxpayer money wasted on golf. That's really good. And Mary says B for the stock market, because of course, by focusing so much on that number and not dealing with the pandemic properly, not going Godzilla, doing what he should have done, put the stock market in the tank for a while. And now we've got a situation where something like, 60% of the businesses that have been pushed out of business during the pandemic are probably not coming back. So the economy is we're going to be having years of dealing with this mess of the economy. Well, I think we need to do some work, I'm sorry to say, because these are sad, sad numbers. They go on 202,213 people dead as of yesterday. We are just climbing right through this. 879 new deaths. If that's someone in your family, of course, it's a tragedy that is probably pretty excruciating at this point. Let's look. It continues on. California, Texas, and Florida continue to be the bulk of the new cases. Looks like maybe Texas is getting a little bit under control. Looks like California is, of the largest of those three states, is better under control, but Florida is having some problems. Let's see. We're looking at Kentucky here. Kentucky, the lovely state of Kentucky. I'm here in Falls of Rough, middle of Grayson County, or an edge of Grayson County. 11 deaths yesterday, and we're hearing that Grayson County is increasing. We have something just short of 6 new cases a day now in Grayson County. I don't have that stat to show you, but that's what's going on. Got a couple other scary things to look at. Let's have a look at this. This is from Johns Hopkins, and it's clear that we are starting a new wave of this disease, and I'm not sure how to make it any clearer. Barbara Tichu's here, and I know Barbara will share another 395 new cases, I guess, in South Dakota. Cindy, is that where you are? I think you're in South Dakota. Anyway, this is getting scary because we really aren't properly responding to the virus yet. And, Americans aren't happy about it. Let's have a look at this. I forget where this came from. This is from Gallup. So Gallup is the polling organization. And Americans' satisfaction with the state of the nation is at 14% and measures about the lowest it has ever been. Looks like it's been 13 a little bit earlier this year, 13 and 13 in June or maybe July, and then in August, 13. So it's come up slightly from August, but it still is one of the lowest they have measured. So this is really, that kind of says it all right now, that we're not happy about this. We're not happy about the way the government has failed to do its job with the pandemic. Now, one of the reasons that this is, that we have failed might be laid at our healthcare system, not our healthcare workers, not our doctors, but our healthcare system, which is a for-profit system. And early on, it looked like our for-profit system was doing okay in terms of stats. It looked good. And also there were some nations that were having a terrible time. Remember, Italy was just having a terrible time. They've got a single-payer system, and they lost control of the virus. Now, part of it is I believe that, I'm not positive about this, but I believe that Italy got the virus weeks and weeks sooner than we did, and it got out of control pretty quickly. And I recall something about it being connected to a fashion show or something. But there's no question that they lost control of it in Italy. However, since then, they've done significantly better. So the guy I'm getting ready to call, John Winkelman, worked in looking for Medicare fraud for most of his working life. But before that, when he was an academic, he studied single payer. Let's call John, see if we can get him on the phone, see if our technology will work today. I hear a ring.
Hello, Hank.
John, how are you doing in these crazy times? How the hell are you doing in these crazy times?
Well, it's kind of weird out here in California with all the fires and the smoke and the heat, and it's. But we're making do.
Now, are there fires anywhere near you?
Fortunately, not.
But you're seeing the results in the sky, I'm guessing.
Yeah. There's a sun out there someplace. Sometimes you see it, but it's certainly not. Unfortunately, it's not keeping the heat from us.
There's sun out there someplace.
That's sun out there someplace. Yes, it's daylight. So
if you had a moment to take a picture of the sky and text it to me, I could share that with everyone.
Okay, I will send you a recent photo.
Okay, that sounds good. And Pam says to say hi to you. Mary Richardson says hi. Everybody remembers you. This is really good.
That's a good thing. I can't get on the page to answer any comments, unfortunately. It's
that's all right.
locking up on me. Yeah.
Yeah, no. But you'll be able to if you are so motivated. And I need to share with everybody that I leaned on John today because I knew I wanted to talk about single payer, and I knew I wanted to have John back and to talk. But normally I spend a couple of hours researching this, and I laid it completely on John today. So John,
yes, thank you very much.
Out.
Thank you. Yeah.
So I really appreciate it.
Glad to help when I can. Yeah.
Right. Well, that's fantastic. So should I put up I have two screenshots. Oh, Barbara wants to know where in California you are.
I am in South Orange County, very near San Clemente and Camp Pendleton. I am north of Camp Pendleton. I am not south of Camp Pendleton. South Orange County. South Orange County.
Close to San Clemente. Okay.
Yes.
And so you're not far from the ocean.
Yeah, fairly. I can see it from our balcony. I can't see it from the first floor, but I can see it from the balcony.
Okay.
We can see Dana. We can see Dana Point, and we're a few minutes from San Juan Capistrano, where the swallows come back every spring.
Maybe not this last spring, or did they? Did they come back?
No, they always come back.
They always come back. Okay.
Always come back.
Well,
they may want to avoid it now that there's all the smoke in the air. Who knows? We'll find out.
That's what I was wondering. That's what I was wondering. Okay, so the first screen that I have, and you won't be able to see this, but this is from an article that you sent to me, and it's got a big maple leaf on it. So
that's the Canadian one, yes. Okay.
It's the Canadian one, and all we're going to look at is the headline for a moment, how Canada got universal health care and what the U.S. could learn.
Yes, good. It's a good piece. It does address COVID in here a little bit as well. So there's, for those who you want to share the link to, they can take a look at it, and it's a PBS piece, really doing a nice comparison. Talks a little bit about some of the politics of American healthcare and the politics of Canadian healthcare, and basically ends with Canadians saying we're just happy we don't have the U.S. system.
Well, I thought Canadians complain about their system all the time, and they're always coming to America. And is that we're always hearing that story?
That is the story that. In this day and age, and the prior 20 years, this is a story that those who do not want single payer like to tell. Yes, there are wait times, but that's going to be the case hey, listen, we have wait times in this country too sometimes. So it's really a function of what story you want to tell for your position as to whether or not the Canadian system is better than the U.S. system, and so in reality, yes, there are people who will come to the United States. Those who can afford it will come to the United States to get surgery from a particular surgeon that will have a much better history than the surgeons in Canada, or they don't want to wait and they can afford to come down to the United States. It has nothing to do with the quality of care. It's more a function of the ability to afford to be able to do something differently. Whereas in Canada they wouldn't pay for it. Whereas here
it would be free.
They have to come down here. In Canada it would be free, or there'd be a small copay and a wait. And the story talks about a woman who was supposed to have knee surgery, and the pandemic interrupted that, and she's very old. And now she doesn't know when they're going to be able to have the surgery, if at all.
Right.
And so, this is, but more importantly, I think part of what I learned from doing this research today is that, and you and I talked about this yesterday, comparing single payer universal coverage countries to the United States and the response to COVID. And I think what I determined in doing this research and finding a few links for you to share with your followers, is that it really isn't the healthcare system in and of itself that makes a difference. It's the political response of the leadership of the country. And that is evident from almost everything I read online today doing this research.
So are you saying that the political response is a bigger deal than the type of healthcare system you have?
Absolutely. Interestingly, one of the pieces I shared with you was the Council on Foreign Relations. It's an older piece from April, and a lot has changed, not a change, but a lot has different from April. But if you look at I don't know if you put that one up for folks, but back in April, it compares 6 different types of systems and the responses, and that's where the politics comes into it as well. But yes, if you have universal coverage, like South Korea, for example, you have those citizens see their physicians 15 times a year. We don't do that in this country.
15 times a year?
15 times a year on average.
I have never seen a physician 15 times a year. Never.
Right. And that's why they are healthier. It's, the idea is to stay healthy. The idea isn't to respond to being sick. You really want to stay healthy. And that's where health maintenance organizations were supposed to do in this country and failed because they became more interested in saving money than they did in keeping people healthy.
Well, I'm going to put a link to that story right in the chat right now. So, so that will be available to everybody if they want to get a look at it. I'm just blown away by that concept of seeing a doctor 15 times. And I'm sure that a lot of what they're doing is, some of it, I suppose, is considered prevention, but some of it's just keeping an eye on you.
Yes, absolutely. I mean, but you're willing to do that because it doesn't cost you. If anything, it's a very small cost.
Right.
And that's the key in the United States from a standpoint of keeping people healthy, being willing to see your doctor. A lot of people are afraid to go to the doctor because of what they might find and what it might cost them because their insurance is so expensive.
That is completely true. I heard stories from women who supposedly were more afraid of their insurance premium going up and the medical costs than they were of finding out that they had breast cancer. So they didn't want to go to the doctor to find out if they had breast cancer.
Right.
And that seems insane.
That is, in my opinion, one of the strongest cases for universal coverage in the United States is that we would take better care of our citizens who would be willing to go to the doctor if they didn't feel that it was going to bankrupt them in the long run because they'd find something that needed a major surgery.
Wow.
Or, some people don't go for they tear a ligament or something in their knee and they don't go to the doctor and it gets worse and worse and worse. And then all of a sudden they're getting a knee replacement instead of a simple arthroscopic surgery, for example. This is what it's human nature not to want to go bankrupt.
It turns out it's human nature not to want to go bankrupt. Yes, isn't that interesting?
Exactly.
I've grabbed the screenshot from the article that you just mentioned, so I'm going to put that up there right now so everybody can see it. And this is from the Council on Foreign Relations, and the link is in the chat if any of you want to get a look at it. But comparing the 6 healthcare systems. But I'm just blown away by the idea. Mary is commenting, and she says, I see a doctor once every 4 years. And Mary, I'm going to guess you're 27, 28 years old. Is that about right? Mary, she may not reveal her actual age. I'm pretty sure.
Mary, give a range of your age. Are you under 40?
Are you under 40? That's just crazy. We should all be going to the doctor for a yearly checkup and probably a checkup every 6 months at least.
Yes, absolutely. Yeah,
it shouldn't be that.
And one of the drawbacks, if Mary is a Kentuckian, one of the drawbacks is the availability of a clinic to go to. Sometimes you just want to go. One of the things that we have a lot of in California are those in and out clinic type of places where if you got the sniffles, you go to the clinic, and rather than trying to get a doctor's appointment, which takes 3 months. How's that going to help? And so, rural America doesn't have that kind of access to healthcare. Part of your contract is improving access to healthcare in rural America. And that's something that universal coverage could potentially help get us there, and where we can invest in rural America.
And preventing disease seems to be the most efficient, cost-efficient way to do this. It hardly costs anything to prevent disease, doesn't it?
That's correct. That goes back to, that's the reason health maintenance organizations were first founded, created in the early 70s, was to do just that. It is far cheap. So if you think about the cost of Medicare as an example. Okay. So the 85%, I think, of the medical care cost is in the last 2 years of life.
How much? Say that again.
I believe 85% of hospital costs are in the last 2 years of life.
Of all medical costs?
For Medicare patients. So it's a high percentage, whether 85, I'm speaking off the top of my recollection, but it's a very high percentage of Medicare costs occur in the last 2 years of a Medicare patient's life, because it's acute treatment of illnesses. And acute care costs significantly more than routine care, right, and preventive care. So if you're going to the doctor and finding things early, you want to find a cancer early. You don't want it to be a stage 4. You want it to be a stage 1 or a stage 2 where it's treatable. Yeah. And so those are the reasons you go to get preventive care. This is one of the reasons when you first sign up for Medicare at 65, they pretty much require you to go get an initial screening by a physician.
And that's what Barbara just commented. I see my doctor twice a year, one of which is an appointment required by Medicare, because they know it saves money if we can just catch things early. And I've got terrible news. Mary has let us know she's over 40. And she goes to the doctor once every 4 years, and she says she has sewn herself up when she needed stitches.
Ouch. So wherever Mary lives, they need better access to clinic care.
Yes.
So that Mary can go to the clinic and not pay a fortune for it and get stitched up by a professional.
Now, Mary, I believe, may be a trained healthcare professional, so I think that's possibly
even so.
Oh, you're getting scolded, Mary. You're getting scolded.
I'm not sure it's a good plan.
It's not sure it's a good plan. Well,
it's hard to see some of these things, from above. You need somebody to be looking at it straight on.
Yes, yes, especially if it's a place you can't reach on your back. That would be tough to stitch up if you had a cut there or something like that. Well,
they only do that in the movies when they do it over the reaching over their shoulders in a mirror. So they do that in the movie.
Yeah, that's true. They do that in the movies. That's just crazy. Well, so look, I'm going to put up another screen, and this is from the other article you suggested. It's from the WHO.
Right.
And they're showing cases and deaths in Canada. And this was as of September 18th. So today.
Are you showing the full map? Are you showing the full map, or have you localized the map?
I localized the map and then scrolled down just to get the stats, because that's all I could fit. Okay. So we've got 139,747 confirmed cases, 9,193 deaths. Now, Canada is 37 million people. We're roughly 330 million. I got the calculator out. Canada is 1/9 of the United States. So if you multiply these by 9, so for deaths, you get 81, 82, 83,000 people dead. Now I'm going to go back to our first 83,000 people dead if Canada were as big as the United States. If the United States had done what Canada did, they would have 83,000 people dead instead of 202 and climbing.
Yeah, well, I might suggest it's a slight generalization. I think you're
just a little.
You're in the right. You're in the right track.
I think I said might, and if I didn't say might, I should. If I didn't say might, I should. But the point is, just by multiplying those numbers out, you get an idea, in a gross sense, how poorly the United States has done to manage this disease.
And that's just in comparison to Canada. So if you share the link with your followers and they go to the site, they'll see the full world map and the colors coding for those countries, for all the countries. And then they can actually hover over each country and see what their case count and death counts are. But the color coding is indicative, and that's kind of the reason I wanted to share this one with you and the group is you can see from the color coding where the dark blue countries are and the kind of governments that go along with them. They're mostly, I don't want to say communist countries, but they're totalitarian countries, Brazil and Russia, and right. India is not, but India is a very poor country. But you kind of see the different color coding and where those universal health coverage countries are with respect to the case counts and the incidence per million, and it's lower. And you can, and going back to the Council on Foreign Relations site, they can see how some of these countries responded to COVID. Of course, it was back at the beginning, but now if they're watching the news at all, you can and getting good news coverage, they'll see that Europe is in phase 2. We've all wave 2, call it wave 2, and whereas United States, we haven't gotten out of wave 1.
Well,
we're heading into flu season.
We're starting.
Our numbers
actually,
have not come down.
There's kind of a third wave coming. Okay, so I've found a way, I think, to show this so that we're looking. The darker blue is worse. So I've been able to put that up. Is that correct? Okay. Darker blue is worse.
Yeah, darker blue is right.
Darker
Higher
blue
percentage.
is worse. Yeah. And that's on cases. It's kind of showing up as green on my monitor. Oh, no, it's showing up as blue over there. And if I switch it to deaths, then it's kind of an orange to brown color. And again, the darker color is worse.
Right.
And so this will give you all an idea of what we're dealing with here. In the United States, we are doing really, really terribly compared to, look at Northern Europe. Northern Europe is doing great. And
Central and Eastern Europe are doing reasonably well too. Certainly Italy and Spain and France they've entered wave 2. And this is the reason that their numbers are back up and they're darker color. They started out poorly. That was really outside of China where they started and had serious numbers before the medical community got a better understanding of COVID. So their numbers they're dark in those countries because they were the start of this.
Right.
They were the ones who got hit the worst, and they haven't been able to. They went way down in their counts and their case counts and their deaths, and now they're starting to spring back up. But they stay in this color because overall, since the beginning of COVID, they've got high numbers. That's why they're that color. But you can look at current case counts somewhere on this page. There's the more current information. It takes some drilling to go through this website.
Right.
Then there's a data table as well, and there's an explore section, so you can actually go through this on your own at your leisure. But you'll see that they have now started to go back up again, and the medical community is considering that wave 2. In the United States, we're at a steady, 40,000 cases a week. It's crazy.
It's crazy.
We have not gotten out of wave 1. Because we haven't taken the appropriate response that the medical community recommended at the beginning, and maybe we would be like Canada had we taken the original the same response that they did.
Now, Jim Porter just mentioned, I think he's restating what you said. The European numbers have started. The EU is starting to rise again, right?
Yes, right.
Any idea what that's related to?
That's the second wave. What everybody has predicted from the beginning was that there would be a wave 1, case counts and deaths would start to drop, and then it would bounce back up in the fall, and that's what we're seeing in Europe. The United States hasn't had an ebb. Where the ebb is, it's been in New York and New Jersey and Connecticut. They've gone way down. Are they going to start to see a wave 2 in the fall? Probably.
Yeah.
Whereas the rest of the country is still in wave 1. You got South Dakota, North Dakota, and Iowa are the three hotspots right now.
Right.
And it took them 6 months to get there.
So what would your grade to President Trump be on the handling of the COVID crisis?
Is that a fair question?
That's what I'm getting asked as a totally serious. The Lexington Herald Leader has sent me a candidate questionnaire. It's an online survey. And what grade would I give President Trump?
For as far as COVID-19, it's a failing
Well, they
grade.
just asked what would you give him a grade for his presidency, and I'm thinking that I should break it down like a report card would be. A report card would have several pieces. So one of the suggestions was spending taxpayer money on golf. He would get an A.
Okay. Absolutely.
I'm going to say
and spending taxpayer money at his properties.
Yeah.
And that's not just him. That's not just him. So you got golf, and then you've got Secret Service, and you've got other countries coming in to spend money at other taxpayer money at his properties, because that's what he hasn't given up, his properties.
Right.
He hasn't put them in a blind trust.
Yes. There is so much that we're going to have to do when President Trump's presidency is finally over, whether it's in November or at some later date. Hopefully he gets voted out in November and leaves peacefully. In fact, John, do you want to play a little quick game of Name That Republican?
We can try.
Okay. I always enjoy this.
This should be interesting.
Okay. Do you want an easy one?
Please.
Okay, here's an easy one.
If I can't get the
Ready?
I guess if I can't get the easy one, I'm in trouble.
It's an easy one. Here you go.
Leaders and fighters for freedom and liberty and the American dream. The best is yet to come.
That's Don Jr.'s girlfriend.
I think you've got that right. Let's see if you can get. This one.
That he's a jackass.
I've got two more of that person. Let's hear that one more time.
That he's a jackass.
I think that's Lindsey.
That is Lindsey Graham. Wow.
Yeah.
Circle gets the square. That's exceptionally good. I've got some really difficult ones that you would never get, but I think you might get this one. Let's try this one.
The potential for the disastrous rise of misplaced power exists and will persist.
Oh.
Let me give you another one from this Republican, okay?
Okay.
Our military organization today bears little relation to that known of any of my predecessors in peacetime, or indeed by the fighting men of World War II or Korea.
My brain's telling me Nixon, but I'm just not hearing it clearly enough that it's Nixon. But
it's very close. It's not Nixon. It is. Well, I'll give you one last one. Let's see if this will help.
Goldwater?
Only an alert and knowledgeable citizenry can compel the proper meshing of the huge industrial and military machinery of defense with our peaceful methods and goals, so that security and liberty may prosper together.
Well,
I think I'm too young for Eisenhower's voice. But
that is Eisenhower. You win.
Okay.
You won the game.
There you go. I wanted to, but if you have a couple more minutes, we might want to go back to.
Let's go back. I have a couple more minutes.
Single payer, just from the standpoint of what COVID-19 has shown us in the United States, and what is the dramatic impact it's having on those who are not able to go back to work. And I think we're going to see over the next 2 months, PPP runs out and a number of companies have already indicated layoffs starting October 1st. I think we're going to start to see a significant increase in the unemployed and a significant increase of those without insurance. And that's going to have a dramatic impact on healthcare delivery and the cost of healthcare delivery, that we might actually get that push for universal coverage. Those who go and read that article on comparing Canada to the United States, there is a former marketing person for a health insurance company who spent most of his career fighting against universal coverage, who now is a leading proponent of Medicare for All. He recognizes that every citizen is better off if there is free access or less costly access to healthcare. We spend a lot of money. There is, and I think we did this on one of my earlier calls, that the amount of money that is in the system far exceeds the cost associated with healthcare, because it's a profit enterprise, a for-profit enterprise. Right. Decisions on healthcare should not be made based on the bottom line. Decisions for healthcare need to be made on behalf of the patient. So and the best way to do that is universal coverage. I'm sorry, go ahead.
Yeah, no, you sought out waste and fraud in Medicare for most of your career, right?
Well, certainly the last 12 years, of my career.
Right. So waste and fraud are, that's a different thing from huge amounts of profit, obscene profit.
That's correct.
Obscene profit is actually illegal, isn't it? It's not fraud.
Yeah. Hey, listen, on the Affordable Care Act, the rules changed with respect to obscene profit in healthcare, because the insurance companies have to spend 80% of their premium dollars on delivery of services.
Wow.
And if they don't spend 80%, they have to refund dollars to those who have paid the premium.
Well, I've gotten a refund check from the insurance company, haven't you?
I did.
Oh, good. I don't think I have.
Two of the first 5 years of the Affordable Care Act, my company got premium dollars back.
Oh,
but more importantly is it's still, notice the number, it's 80%. Okay. Administrative costs for private insurance, 6%. So that's 14% profit.
14% profit. 14%.
If their administrative costs are 6%.
And this is, by the way, what they do in France. They do the French apparently will laugh at you if you call their thing socialist medicine. They say, no, that's Canada is socialist medicine. We have a mixed system, and they do a non-profit insurance company, health insurance company, to just deal with sending out making sure everybody gets paid, making sure doctors and hospitals and so on get paid. My wife just let me know that we got an $8 refund one time.
There you go.
So they really have their they know their onions. They know how to dial that in. That's really good.
Well, I haven't gotten, I know the last, 7 years of my company, I didn't get any back. So they clearly were spending their 80%, or they were lying, one or the other. But more importantly though, the point on the fraud, waste and abuse in Medicare is, it's estimated as high as 15% of the cost of Medicare, which is $800 billion a year for Medicare, $750 billion a year. 15% of that is over $100 billion of fraud, waste and abuse. That's a lot of money.
And
there's way more money in the system. Yeah, go ahead.
And that still doesn't include excessive profits, because those are legal. Those aren't considered abuse.
That's correct.
So that's why
administrative costs in Medicare are under 3%.
So it seems to me that the number that we see when we compare the amount that gets spent per patient, or when we look at a percentage of GDP, gross domestic product, we find that nations like Canada, New Zealand, France, Australia, England, they spend about 40% less than we do in the United States. And all of them, I think, get better results, and the systems are easier to use, and they cover everyone. So is 40% a possibility if the United States was willing to go at it?
I'm sorry, 40% of what?
Saving 40% of what we spend right now on
Yeah,
healthcare.
I think that's a little high. I think ideally you want to get that 15%, 18% out of the system that goes towards profit. So right now I said it was 14%, but if you go if Medicare runs a thing and keeps their administrative costs down under 3%, you're actually talking about a 17 or 18% decrease, in cost, because you're taking profit out. Medicare is not a for-profit.
Right. Well, there's going to have to be some profit, isn't there, in terms of pharmaceuticals and hospitals providing services and.
Well, nobody is suggesting that the payments made to providers be limited to their costs. There's always a cost plus component to Medicare.
Okay.
Having done cost reports for the first 20 years of my career, it's a cost plus arrangement. Medicaid's a little bit different because they really limit the profit. Medicare does allow profit, but they still keep their costs down. Now, the big thing is if you put, with a 15%, potentially 15% of fraud, waste, and abuse in Medicare, if you increase and go to the Medicare for All and drive it there the way Bernie would, my preference would be to just offer Medicare for everyone and let them choose it if they want it.
Right.
And then there'd be a much slower transition, but eventually I think people recognize that they'll be better off on the Medicare. You got to work really hard to keep the fraud number below 15%, because the crooks are going to. Let's not forget, there's fraud in private insurance too.
There's fraud everywhere, unfortunately.
There's fraud. Yeah. People try to steal information so that they can make money off of fraudulent claims. Doesn't matter what industry it is. But I think one of the points I wanted to bring up, what you were referring to on GDP, the Canada article, the PBS article,
yes,
shows a chart. I don't know if you brought that up on the screen of where how much we spend of our gross domestic product versus the rest of these countries, and we are far and away above what any. And Switzerland is second at 12%, and we're at 17%.
That's
so,
from the
yeah.
That's from the Canadian article, because I'm going to try and grab
the PBS piece, and if you're able to scroll down for folks, they can see the chart in there. Healthcare. So it's U.S. spends the most on healthcare compared to GDP.
Oh, they spend the most. Yeah, they're. What number did you see there?
It's 17% for the U.S. in this chart. This is as of August 28th.
Because I have seen higher numbers, so I suppose that's how they counted. I saw 17.8 several years ago.
Right.
And speculation. Let's see if I can do this. Let's see. I'm going to look for this while. Let's see. I'm going to go to your email and see if I can grab this up quickly.
Now, the other thing while you're doing that, the other thing I'd like to say is that we spend the most and our outcomes are nowhere near the best.
Right.
We do things primarily in many cases we do things to avoid litigation. So the provider will do something that costs more money because it's safer, and they're afraid of being sued. So, for example, the easiest example to share is vaginal births after C-section. So in this country, unlike most countries, if you have a woman has a C-section, delivers via C-section, it is highly unlikely that their obstetrician will recommend going to a vaginal birth the next time.
Right.
And that is highly unusual in relation to the rest of the tier one, countries.
I found your chart. And I've been saying all along, Switzerland is the closest thing to the Affordable Care Act in terms of structure, I believe. That's the only other country. Every other one, Germany, I think, is single payer.
Yes. Mm-hmm.
Right. And look at how many are clustered at around 11%. And then they drop even further on down. Let me see if I can see.
Yeah, well, I think I would worry about the countries at the bottom.
Okay.
And,
fair enough.
And the quality of the care from in those countries.
Fair enough.
That are spending that little.
The one I'm looking for is.
I would not be worried about Israel. I understand healthcare in Israel is very good, and they're under 8%.
Yes. I was thinking of Taiwan, which recently we redid their healthcare, and they're at around 7% right now.
Yeah.
So.
And they are the first country listed in that comparison of the 6. Is Taiwan.
Oh, I see. Okay. Very good. Well, I'm going to put this article in there. Well, John, thank you so much. I have to say, I'm a little bit overwhelmed by all of this. This is kind of...
and that is one of the other wonderful issues of our healthcare system is it is, in fact, overwhelming. Even when you get to Medicare, it's overwhelming because they've got open enrollment every fall, and you've got to decide what you're going to do.
Yeah.
And that's complicated for those, I'm in the business, so I spend a lot of time looking at what choices to make every fall.
And those are hours that all of us are spending that are just wasted hours we wouldn't have to do in a proper single payer system.
Right.
Yeah.
Yes.
I think that's a great way to close this. John, thank you so much for helping us learn about this. I noticed we had a lot of people still hanging on. I hope everybody's still going to share. I lost my.
And if all goes well, I'll be able to go back out later and look at the comments and see where I can respond.
Very good. John, as always, I appreciate it. Thank you so much for helping us out. And we'll get you back with Dr. Greg as soon as we can. He theoretically is available next week, so we will see.
Okay. All right. Sounds good.
John, thank you so much. I hope you have a great
day. Everybody stay safe and healthy.
You too.
All right. Bye.
Bye. All right. John Winkelman, thank you all for being here. This is that was a long one. I'm amazed at how many of you hung in there, and I'm really pleased. That's really wonderful. I do have some new music to play. Yesterday it wasn't loud enough, and when I played the Godzilla sound, it was way loud. Anyway, thank you all for being here. It is Friday, so I'm going to take, I'll be doing other things tomorrow and Sunday. And a week from tomorrow, we'll do our first online fundraiser Saturday afternoon. We'll get the details to you about that this week. John probably does need his own song. Thank you all for being here. It's a privilege to have you all show up. It lifts my spirits to see your names there each day and see how many of you listen to this. So thank you all so much. We've got a lot of work to do. We really need to show up for this election, folks. Okay, counting on you. Y'all be good.